have our global and public health CTAs. Please welcome Nonoy Koleko from CareSpan Asia to share about their partnership with Temasek Foundation in enabling healthcare access in the Philippines. Nonoy, please.
Hello everyone, I'm Nonoy Koleko, and I'm here to tell you how a few dollars can help provide healthcare for life for someone without it. Those of you who have seen a doctor in the past 90 days, please raise your hands. Those of you who have seen a doctor in the past year, please raise your hands. 60 million Filipinos are unable to often see a doctor. Many others live in islands with poor access to healthcare, while many others live in crowded urban slums with inadequate health facilities. All live in health poverty. Meet Roberto and Isabel, who live on the island of Tabaco, Albay. Isabel has lived on the island her whole life, and due to that lack of access, had no choice but to self-medicate whenever she fell ill. Recently, for the first time, she was able to consult a doctor at her local barangay health center through telemedicine. There, a doctor gave her a health exam via the CareSpan digital health platform. The health worker in the barangay used a stethoscope and other medical devices integrated with CareSpan. It was only then that Isabel learned that she is at risk of heart problems and hypertension. Likewise, Roberto learned about his type 2 diabetes also through his telehealth consultation. Now through CareSpan, their doctor monitors their medical conditions and provides timely care. Roberto manages his diabetes with proper medications. Isabel is on the right diet. She gets treated for headaches and pain, reducing her risks of developing serious chronic illness. Isabel and Roberto's access to free quality healthcare is made possible through the launch of universal healthcare by the government in 2023. Universal healthcare reimburses cities for primary care for their constituents. All Filipinos are now entitled to receive free or subsidized primary care and chronic care for life, but only if they are enrolled in the government system. Unfortunately, 60 million underserved are not accessing universal health care due to a number of barriers. First is a lack of awareness and healthcare literacy. Even worse, fear and misconception around crippling medical expenses among residents. Someone needs to lead community outreach and communications to educate residents. Secondly, there is a lack of technical skills, hardware, and funding. Someone needs to supply the barangay health centers with telehealth and electronic medical records, which are requirements of universal health care. To achieve the above, a new public-private philanthropy partnership is our answer. With support from the Temasek Foundation, CareSpan Asia is bringing together multiple stakeholders. Together, they will make universal health care not just a policy, but a reality for 700,000 people. And hopefully, with your help, many more. Gawad Kalinga, a community-based NGO, will provide outreach and education. GK will promote health-seeking endeavors and onboard low-income households to universal health care. These families can then receive online consultations and develop their personal electronic medical records at barangay health centers using the CareSpan digital platform. CareSpan's platform is approved for universal health care by the Philippine government. Like we saw with Isabel and Roberto, this connects government doctors in the city to people in remote areas. CareSpan will report the technological integration by installing routers and computers. Under universal healthcare, the Philippine government will then reimburse the local government based on the citizens registering onto the platforms. Electronic medical records will enable the local governments to make better population health decisions. In the future, we can develop more effective interventions for chronic care and maternal and child care. Doctors can treat 2 or 3 times more patients than they could before. We need your help to pilot this PPP partnership to enable the underserved to access primary health care. We hope to demonstrate that this solution is financially sustainable when we reach economies of scale. If successful, this will serve as a model that can be replicated in other cities. Philanthropy can help us unlock the full potential of our solution. Healthcare starts by ensuring that all have access. Then we can prevent illnesses and improve health, thereby transforming and saving lives. Please help. Thank you.
Thank you, Noy. Next, please welcome Kanika Bal from Evidence Action to share about their work providing safe water to save lives across India. Kanika, please.
Thanks so much for having me. It's such a pleasure to be here. If you'll indulge me, I'd like to ask you for a slightly unusual request. Please take a sip of the water in front of you. And as you do so, concentrate on the thought that crosses your mind. You're not all drinking your water. Please drink your water. I imagine not one of you thought about becoming ill as you took that sip. But 2 billion people worldwide face a far different reality. Their water is contaminated, and a single sip can be deadly. Unsafe water causes many debilitating diseases, but it's particularly deadly for the youngest and most vulnerable, children under 5. Today, there are huge global investments to improve infrastructure, including taps and wells. But the truth is, infrastructure alone cannot make water safe to drink. I just flew here from Delhi, where I, like many of you, I'm sure, studiously avoided drinking the tap water. That's because untreated tap water can still be dangerous and contaminated. That's why water treatment is needed. We know it works, and we know it saves lives. We know that because of the groundbreaking work of Professor Michael Kramer, who we're very fortunate to have here with us, which showed that treating water reduces under 5 mortality by 25%. That means an astounding 1 in 4 child lives can be saved simply by treating water. As Evidence Action's name suggests, we take rigorous evidence and we move it into rapid action. We have scaled safe water to reach over 10 million people across Africa. Now, we're taking on the world's largest country, India, where a large proportion of the country's more than 1.4 billion people drink unsafe water. It's going to be one of the most ambitious safe water projects in history. Well, this is a project of unprecedented scale. It's actually grounded in a simple, low-cost solution, chlorine. Chlorine is used in most high-income countries. In fact, if you're drinking the tap water here in lovely Singapore, you are drinking chlorinated water. Chlorine is safe, proven to kill pathogens, and it's incredibly inexpensive to deliver. In India, we will rapidly and dramatically scale access to chlorination. We'll do this by installing simple, low-cost devices within piped connections. And we're not doing it alone. We are partnering with the government of India. The government has committed to providing safe tap water to every rural household in the country. they've made tremendous progress installing over 98 million household connections in the last 4 years alone. But progress on making that water safe to drink has lagged due to gaps in technical know-how and experience. That's where evidence action comes in. As the government installs piped connections across the country, we'll work alongside them to make that water safe to drink. We recently concluded a 3-state device pilot to tremendous results, showing how effectively these devices work in the Indian context. In fact, Professor Kramer and I just flew in from a meeting with the Indian government leadership, who've told us in no uncertain terms they needed our help yesterday. They've asked us to partner with them on an enormous national scale-up. We know we can do this because we've done it before. We used an identical blueprint to scale deworming treatment across the country, working with the Indian government. With our support, the country went from a near standing start on deworming treatment to reaching over 200 million children every year. This work will transform the landscape of child health in India. We're not just talking about giving 400 million people access to safe water. We're talking about healthier children, brighter futures, and stronger communities for generations to come. But forces have converged to give us a time-limited window to act. Right now, the political will for safe water in India is enormous, as is the leverage opportunity. For every $15 the government spends on installing taps, just one additional philanthropic dollar makes that water safe to drink. The chance to invest in a project of this scale, at this level of cost effectiveness, is a once-in-a-generation opportunity. It will cost just $1.50 to provide a full year of safe water to a person. That means for the cost of a bottle of water in Singapore, we can be purchasing safe water for a person for a year. We all know philanthropy has the power to catalyze transformational change, but only when we're willing to invest real capital and see long-term projects through to their end game. Every contribution is welcome and meaningful on this journey. Together, we can make safe water for all a reality. Thank you.
Thank you, Kanika. Finally, please welcome Professor Paul Pronick from Duke and US Medical School to share how they are leveraging genomic detection for infectious disease elimination across Asia. Paul, please.
Good morning. Before lunch, I'd like to introduce us to baby Inti. She's 3 years old, she's from Indonesia, and she hasn't been feeling well this past week. What if we could rapidly and accurately help to diagnose the cause of her fever? Now, I've been working as an infectious disease doctor for the past 20 years, largely in poor countries in Africa and Asia, including the last 5 years in Indonesia. And despite being the #1 killer of children, the vast majority of infections go completely undiagnosed. And the reason for this is that most folks don't have access to basic laboratory services. The technologies that we use to diagnose bacterial infections are about 150 years old, and on the ground, there's no easy way to diagnose a viral infection. And when you're managing infections, time is of the essence. Any delays means baby Inti might not get the correct medicine, and on a wider scale, it means we're not going to know what's circulating in her village, including epidemics. And this is very important, as Asia is the region of the world at highest risk of outbreaks due to climate change, environmental pressures, population mobility, etc. Ladies and gentlemen, this is a genomic sequencer. It can analyze 50 specimens at once. I can plug it into the back of my laptop, and it can start generating genetic information within hours. It can be deployed anywhere by anyone without the need of a sophisticated laboratory infrastructure. Because it's reading genetic code, it can tell you if your sample is something that you've previously known about or whether it's unknown. If it finds a bacteria, it can tell you what species that bacteria is and whether it's going to respond to antibiotics. If you pick up a virus, it can tell you the virus today in Singapore that you found, whether it's related to one in Shanghai last week or one picked up in Sumatra last month. What's also important to understand about genomics is it's foundational. It's a building block for other tools. Everybody's seen rapid tests for COVID. That's all from genetic data, right? But it looks for one single thing, extremely useful as a screening tool. Everybody's heard about mRNA vaccines by now. Well, mRNA is just code that's derived from the genetic information produced by these devices. And it's reverse engineered into a vaccine that helps protect the body. Now, all of these technologies had been nascent and percolating under the surface for quite some time. And it's really during the COVID epidemic that they were deployed at scale. And for me, it's our opportunity, indeed it's our responsibility to try and leverage this learning and apply it to addressing common infectious threats. Well, this is where Asia PGI comes in, the Asia Pathogen Genomics Initiative. It was set up with the support of the Bill and Melinda Gates Foundation in 2021 at Duke NUS Medical School. And Duke NUS has been a pioneer working on infectious diseases and genomics for more than a decade in the region. But nonetheless, Asia PGI is a full team effort. It brings together the Singapore government's national pandemic program, known as PREPARE, our School of Public Health, our Agency for Science, Technology and Research, known as A*STAR. And over the course of the last couple of years, we've established partnerships with 14 countries, from India all the way through to Indonesia. If COVID has taught us anything, is that we're going to move much more quickly in this new space if we move together. I'm pleased to report that all countries in Asia now have in-country capacity to do genomics. But I'm not going to lie, it's going to be a heavy lift to really make it work. That's why we at Asia PGI have been working closely with governments, with the World Health Organization, on helping countries to prioritize pathogens for this new technology, from tuberculosis all the way through to typhoid. It's expensive, and all the manufacturers, there's only 3 of them, are located here in Singapore, and we've been working with them to make the technology as accessible and affordable as possible. A training institute has been set up here in Singapore so countries can have hands-on exposure to the different types of genomic platforms and understand their strengths and weaknesses. And finally, systems exist to share genetic data so that all countries have access to an early warning system. So in conclusion, genomics really is the step that can help us reach COVID's silver lining. As a doctor working in this space, I've never been so excited, and I think babies like the child Inti really need our support. So let's together imagine a future where infectious disease threats aren't things that appear in our headlines and shut down our cities. Instead, let's make them something for our history books and something that we can visit in our museums. I thank you.